Go ahead.
Good morning, good afternoon, good evening. Welcome everyone to today's webinar. My name is Nandita Tate with the IBP Network based at WHO in Geneva, Switzerland. Today's webinar will be focusing on a new tool that we are launching that links the WHO guidelines and the high impact practices in family planning. Before we start, I just want to give a little bit of background on how this tool was created and why, and a little bit about IBP. The IBP network is a group of about 80 plus organizations that includes NGOs, CSOs, academic partners, and others, dedicated to supporting the dissemination and use of evidence-based guidelines and practices in family planning and reproductive health. In 2018, we conducted a survey to better understand how our partners used WHO guidelines and the high impact practices in their work. And the results were mixed. Many said that they were aware of WHO guidelines and really valued the importance of these resources, but use was mixed, especially among implementers, because many said that we don't program around a guideline, we program around an intervention or a practice. In the same way, many were familiar with the high impact practices, but implementation and support to using them was mixed, and there was a need to better link them to evidence-based guidelines coming from organizations like WHO. So based on that feedback, we developed this tool to better link WHO guidelines with the high impact practices. This was a very collaborative process with input from many of our partners through our network and beyond, including some in-person testing and trials at IBP regional meetings in India in 2018 and in Istanbul in 2019. So we are thrilled to finally be able to present the final tool to you and get your feedback and input on how this can better support your work. So before we get started, we'll go to the next slide. Just going over today's agenda, we'll hear from Dr. James Chiari from WHO. We'll then have our colleague Lucy Wilson go through in detail the HIP matrix tool, provide an overview. And then we'll hear from Tembi Mugore on some implementation experiences and how you might find this useful in your work. Finally, we will close with some questions and answers that I will moderate, and then we will close. Next. Just a reminder before we begin that the webinar will be recorded, and we will share that recording after today's session. Please do submit your questions using the question panel on the right-hand side of your screen. We'll use those for the Q&A at the end. Also, there is a tab where you can download the handouts, including the tool that is available in English, French, Spanish, and Portuguese. So please do take a look at that. We've also included today's slide presentation in the handouts. And finally, for more information, you can visit our website, ibpnetwork.org. Next. So I will get to introduce our presenters shortly, but before we do that, we would like to know who we have on the line. So we've created a poll just to get a sense of who we have with us today. So please describe the kind of work you do on a daily basis related to family planning and reproductive health. Are you a policymaker, researcher, program implementer, trainer, or advocacy professional, or a student? So just take a few minutes, let us know who we have on the line with us. That'll help us get an idea of how of who we're talking to and potentially how we can support future webinars on this tool. Okay, and I think maybe we can show the results shortly. I understand that there are more than one, but just pick one for the sake of the poll. Unfortunately, we can't have multiple choices. Okay, well, here are the results. We see that a lot of people are program implementers, researchers. We've got some trainers here as well. So that's really helpful for us to know as we go through the tool today. Thank you for that. Okay, so with that, I'd like to welcome our panelists today. As I mentioned earlier, Dr. James Chiari, Lucy Wilson, and Tembe Mugore. And we will start with our first presenter, Dr. Chiari. I'll turn it over to you. Dr. Chiari is the head of the Contraception and Fertility Care Unit at WHO's Department of Sexual and Reproductive Health and Research. James, over to you.
Yeah, thank you so very much, Nandita. And thanks, ADOS and the organizers of this webinar for inviting me to make a short presentation before we go to the tool that is being implemented today. I think for us from the World Health Organization and from the Human Reproduction Program, we regularly put out updates of our family planning guidelines. And our aim is always to improve policy and programs in sexual reproductive health. And in this case, we are talking specifically about family planning. However, we know that guidelines are only as good as their use at country level. So if they do not lead to changes in policy or practice, then issuing guidelines is kind of not a useful task. Through our engagement with ministries of health, we have been documenting use of WHO guidelines in development of national policies and in development of national guidelines and tools. And I'll just give you an example. In 2019, we conducted a policy survey, and of 155 member states that responded to that survey, 86% reported they had national policies or guidelines on contraception use, and 60% on task sharing that were informed by WHO recommendations. And therefore, we have no doubt that there is use, particularly through the ministries of health, of the WHO recommendations that we are putting out. However, increasingly we recognize that another critical audience in ensuring that WHO guidelines inform practice is implementing partners. And this is a very broad group of implementing partners. I'm thinking of it in the broadest sense to include NGOs, CBOs, academic organizations, researchers, and other partners who are working either directly in service delivery or just supporting service delivery. And through the IBP network, we have this opportunity and unique ability to reach to this wider network of implementing partners. And the IBP network already provides valuable input when we update and develop guidelines. And so we are really happy at this opportunity today that we are exploring ways for you as implementing partners to use WHO guidelines more effectively in planning and executing your mandates. And maybe before I end, I mentioned something about the high impact practices. We know that these are frequently used in advocating for, designing, training on, and delivering family planning interventions. And what we are going to hear today is about a tool that can be used to facilitate use of WHO guidelines alongside service delivery high impact practices. This tool, I believe, is a great resource because it builds on existing WHO materials and it also puts them in one easy to access place. In addition, it provides some examples of how each of the materials presented can be used to strengthen program work. I'm really looking forward to hearing more about how our partners can use this tool to better incorporate WHO guidelines into their work and to improve the lives of women and children all over the world, which is actually the impact that we all are endeavoring to have. And thank you very much again for inviting me, and I'm really looking forward to hearing more from the presenters. Over back to you, Nandita.
Wonderful. Thank you, James, for your inspiring remarks and for your support on behalf of WHO to the IBP network and the development of this important tool. I will now like to introduce our next speaker, Lucy Wilson. Lucy has over 15 years of experience in sexual and reproductive health programs, research, and policy. She is now an independent consultant with Rising Outcomes. And Lucy was instrumental in working with the team here and our network of partners to really help put this tool together. So we thank you for your work, Lucy, and I'll turn it over to you. Thanks.
Thank you, Nandita, for the introduction, and thanks to the WHO and IBP team for inviting me to talk about the Matrix tool today. And greetings to all of our participants. Next slide. So the Matrix tool is a simple 4-page document. If you use it online, it has lots of embedded hyperlinks that take you to other resources, such as the HIP briefs and the WHO guidelines and tools. And if you choose to print it out, it's a handy quick reference to have tacked to your bulletin board. I'm going to walk through the tool today page by page, starting here on page 1, which provides the background and introductory information. On subsequent slides, we'll zoom in to look at the page more closely, starting with the top section in gray. Next. In this top gray section, we have the challenge that this tool responds to, the solution it offers, its purpose and audience. Nandita and James spoke to most of this already, but I'll just highlight that we developed it with program managers in mind, especially those who may have familiarity with the high impact practices, but not so much with the WHO guidelines, or familiarity with the WHO guidelines, but a lack of clarity for how they can be implemented alongside the high impact practices. Next slide. So moving to the middle section of the first page, we see a description for the 2 main aspects of the tool, the matrix itself, which is on page 2, and the reference sheet on page 3 and 4. The matrix provides suggestions for how the high impact practices and the WHO guidelines and tools can be used together. The suggestions include advocacy, program design, provider reference, and training. For example, the WHO guidelines can be useful in considering program design when implementing the high impact practices, or can serve as a reference for providers when they are delivering family planning services through one of the high impact practices. The reference sheet on pages 3 or 4 provides some basic information on the high impact practices and the WHO guidelines and tools for those who aren't familiar with a specific guideline or tool. And it also includes more specific examples for how you can use the WHO guidelines and high impact practices together. Next slide. At the bottom of the first page, there are a few points of clarification in fine print. Most importantly, the WHO guidelines and tools are global documents, which are often adapted to the specific country or program context. They may be incorporated into national service delivery guidelines or job aids or training materials. And when these adaptations exist, they should also be taken into consideration alongside other local context, guidance, and priorities when considering the high impact practices and the guidelines. Next slide. So this is page 2, the matrix, which is the heart of the tool. Look for the instructions at the top left-hand corner. First, choose which high impact practice you are working on. The HIPs run along the top of the matrix. Note that these are only the 8 service delivery high impact practices. Then look down the column on the left-hand side of the matrix to choose the WHO guideline or tool, and find where the row meets where the WHO guideline or tool row meets the high impact practice column. Where they meet is a suggestion, or sometimes 2. You'll see some boxes are split into 2 suggestions on how to use the WHO guideline or tool to support HIP implementation. Again, the suggestions here are advocacy, program design, provider reference, and training. And we'll zoom in a bit closer on the next slide. Great, So let's imagine that we're part of a team that is considering the implementation of family planning services through mobile outreach programs. This is a high impact practice shown here on the matrix along the top row, circled in orange. And we want to be evidence-based and follow global guidance from the WHO. And so are looking for additional information on the appropriate tasks for different levels of providers participating in mobile outreach. So we looked at the WHO guideline, optimizing health worker roles through task shifting, which is circled in green here. Following where the green and orange ovals meet, the matrix suggests that there are two ways to use this WHO guideline alongside mobile outreach, in advocacy and in program design. For example, the WHO task shifting guidelines can be used to support program design decisions, such as choosing the most appropriate providers to staff the mobile outreach, the services they provide, and whether or not the mobile providers will conduct on-the-job training to local providers. Second, as a global resource, the WHO guidance can also be used to support advocacy for mobile outreach approaches for reaching hard-to-reach clients with the services they need and desire. Hopefully this makes sense, and hopefully if not, you'll be asking questions in the chat box for clarification. Next slide. The final 2 pages of the tool are the reference sheet, which provide additional information about and links to the HIPs and the WHO guidelines and tools. We'll zoom in again for a bit more information. Next slide. The Matrix tool includes 6 WHO guidelines and 3 tools most relevant to family planning programs. They are shown here, starting at the top and moving clockwise around the circle. There's the medical eligibility criteria for contraceptive use and its accompanying tool, the MEC wheel, as well as the selected practice recommendations for contraceptive use. Other guidelines include Optimize MNH, optimizing health worker roles to improve access to key maternal and newborn health interventions through task shifting, which is the orange and red guideline on the far right. The next guideline in gray is the perhaps lesser known but really great Ensuring Human Rights in the Provision of Contraceptive Information and Services, Guidance and Recommendations. At the bottom in pale blue is WHO's guideline of recommendations on digital interventions for health system strengthening. Then with the magenta accent is the newly released WHO Consolidated Guidelines on Self-Care. Finally, there are the WHO tools, the Family Planning Handbook for Providers in green, and the Family Planning Training Resource Package. Next slide. The HIPs, the high impact practices for family planning, are a set of evidence-based practices vetted by experts against specific criteria and documented in an easy to use format. Each HIP has an 8-page brief that brings together the most relevant evidence and information for use in, again, advocacy, program design, also strategic planning, etc. This tool focuses on the 8 service delivery high impact practices. There are also enabling environment and social and behavior change HIPs, as well as HIP enhancements, which are not covered by the WHO HIP matrix tool. Next slide. Again, on the reference sheet, pages 3 and 4 of the matrix tool, for each tool and guideline, there is an image of the cover and a hyperlink embedded in the title of the document. Then there's a brief description of the purpose of the guideline or tool. So for this guideline on ensuring human rights, the purpose is to provide guidance on actions that should be taken to ensure that human rights are systematically and clearly integrated into contraceptive service provision. Then for each guideline, there are 1 or 2 bullets that describe how the guideline can be used alongside the HIPs through the relevant actions: advocacy, training, program design, provider reference. These are shown in bold. So this guideline can be used to support rights-based advocacy for implementation and scale-up of HIPs. And it can also be used in developing training materials for providers to ensure rights-based care when implementing HIP services. Finally, at the bottom, there's a specific example of how the guideline can be used alongside a HIP. These examples hopefully bring the possibilities to life and provide more specific inspiration for integrated use. Next slide. And voila, that is the extent of the tool. To wrap up, I'd like to thank everyone who provided their review and input on the tool. Like so many things that IBP does, this was truly a collaborative effort. The many people listed on the slide here, and I perhaps have forgotten a few as well, all provided substantial review and input on at least one, if not many drafts of this tool. And this tool had many drafts and iterations evolving through the process. So we thank you for your input. And in the end, I believe it is a useful tool, and hopefully you will find ways to use it in your work. Back to you, Nandita.
Wonderful. Thank you, Lucy. That was an excellent and thorough overview of the tool. Just a reminder to those on the line that you can download the tool in the Handouts tab on the right-hand side of your screen. The tool is available in English, French, Spanish, and Portuguese. If you're interested in seeing more about the WHO guidelines, you can visit the WHO website, who.int/reproductive health, or many of our guidelines are on the srhr.org website as well. Please do submit your questions in the question box so we can have a robust discussion at the end. Thank you again, Lucy, for going over the tool. I would now like to hand it over to our third presenter, Thembi Mugore. She's a nurse, midwife, and public health professional with extensive experience and expertise in a number of things, including policies, strategy development, clinical service delivery strengthening, training, etc. She is a longtime champion of IBP. She's provided technical assistance and has helped build capacity for improvements in programming, development of service delivery guidelines, and a number of other things. And we are thrilled to have her with us today to provide some reflections and insights onto how a tool like this might be useful in work at a country level. Thembi, over to you.
Thank you, Nandita, for that introduction. I just want to add to the introduction that prior to, not very long ago, I was seconded by IntraHealth to the Evidence to Action Project, which is USAID-funded global family planning project. And two of the country experiences I am going to share on use of the WHO guidelines, tools, and high impact practices were during my time at E2A, which is led by Pathfinder International, and I worked with colleagues from Pathfinder International as well as IBP. I will give examples of when the tools were used in training, for advocacy, plus program design, and tools that were used for provider references. What you will note from my experiences is that multiple tools and guidelines can be used to support implementation of one or two high impact practices simultaneously. And vice versa, what you also notice is that multiple high impact practices can provide or can be used together with one or two WHO tools and guidelines. It depends on the situation and what you are trying to address. So what I'm saying is that they are very multi-purpose. I welcome the tool. When I reviewed the tool, I went, yes, something that brings all the HIPs and the WHO tools and guidelines for family planning in one place for reference, and all one needs to do is to search. I will start with a country experience in implementing a high impact practice, which is post-abortion family planning, which is a service delivery HIP in Togo. There were various needs that brought in various of the WHO guidelines and tools. There was need to clarify policies and guidelines on the role of nurses and midwives in management of complications related to incomplete abortion. There was also need to update the knowledge and skills of family planning providers on provisional contraceptives as well as management of abortion complications. there was need to provide those service providers with references that they could use on the job on a day-to-day basis to keep themselves updated. I will go back when we were talking about looking at the advocacy for policies and guidelines. The WHO tool on optimizing health worker roles through task shifting became very important to understand, to say there is adequate evidence that nurses and midwives can manage abortion-related complications, including using the manual vacuum aspiration. And that led to updating the policies at that time to ensure that there's clarity that the nurses and midwives can do that. And so the HIP there was post-abortion care, and it's very clear that it does talk that nurses and midwives can do that. But the WHO guidelines on task sharing did support that and translate that into policy. In conducting training and updating the knowledge and skills of the same providers who were providing family planning services as well as post-abortion care. We used the training resource package to update the training materials and curricula. It had just come out at that time, so we had a very evidence-based and updated set of tools to use to update curricula. And at the same time, we also used the WHO medical eligibility criteria guideline, which had also just come out, to address what I always call provider-driven medical barriers to contraceptive use. For service providers, we provided the following references to continually address barriers related to contraceptive use. The medical eligibility criteria will became a very useful tool for service providers to have as a job aid, as well as the family planning handbook for providers as day-to-day reference if they were not sure about anything that or to refer during their training of others and to update themselves. So in that, you see multiple tools supporting implementation of that one high impact practice, which is post-abortion care. Now, the second one I'm going to talk about is a WHO tool that also used as reference multiple high impact practices. And we worked with Pathfinder International and IBP to strengthen family planning training in pre-service education. And there was a tool that was available and ready for adaptation. That's the training resource package for family planning, or the TRP in short. That was really meant for in-service training, but the requirement was that it be adapted for pre-service education of nurses and midwives. It wasn't used alone as just the TRP. We used the TRP with the family planning handbook for providers, the medical eligibility criteria, including the will, selected practice recommendations, and ensuring human rights in contraceptive provision. For the HIPs, we also did some advocacy within educators, as well as updating their knowledge on immediate postpartum family planning immunization integration, HIV family planning integration, mobile outreach, and the role of community health workers in family planning service provision. What we did was, at the start of the workshop, we had IBP, represented by ADOS, start with the introduction of the various tools and guidelines that were available for use as reference by the educators, as well as the high impact practices And that was a very aha. So this is all available to us in terms of the just the depth of tools that were available that the educators could use as reference in the adaptation or strengthening the curricula. And they then use them for their own libraries continuously thereafter, because they were available for them to download, they were available in hard copy, and they became very useful in ensuring that pre-service education curricula is evidence-based and is also very updated at that point in time. The last country experience that I'm going to share is South Sudan. In South Sudan, they recognized the role of community health workers and the role community health workers could play in family planning service provision. But we're not so sure whether community health workers should just mobilize communities and give health education talks. And one tool that became very, very useful is the WHO guideline on task sharing that elaborated what services community health workers could provide. And we use that guideline, including advocating for provision of injectable cyanopress at community level by community health workers, and that influence updatedness in policy. That also used the WHO guidelines were also used for adapting for training of community health workers, as well as promoting the high impact practice on CHWs. We found that the guidelines and tools and the HIPs can be used and are very useful when used together in a complementary manner and depending on what need you are trying to meet. But like James said earlier on, guidelines, HIPs are just as good as their use at various levels of the health system, at policy level, but particularly for service providers. And unfortunately, they are used, but they don't filter down as fast. And I think it's everybody's role that at every opportunity, it is important to call out that you are using this WHO guideline and this is a high impact practice, for us to better understand and to better share experiences in use of both the WHO guidelines and tools and the high impact practices for family planning. So that's, for me, are the three country experiences that I wanted to share, and the interdependence of the HIPs and the WHO guidelines and tools, and how they can be used together and how they can be used together to strengthen both programming, training, advocacy, policies, and guidelines at country level. Thank you.
Wonderful. Thank you, Thembi. Those are some excellent examples that you shared at the country level. So I encourage those on the line to please submit your questions. We do have a few that I will start with. Thank you again to all of our presenters. One question that has come up is that there has been a lot of discussion about self-care and the new WHO self-care guidelines. And the question is around, how do we see the self-care guidelines being used for various interventions like self-injection or others? So maybe I will ask, maybe James can comment a little bit on the self-care guidelines, and then maybe Thembi has some insight onto how to incorporate these guidelines with self-injection. James, do you want to comment a little bit on the self-care, the new self-care guidelines and their role in family planning?
Yeah, thank you, Nandita. Yeah, I was still on mute. Yeah, so the self-care guidelines are really kind of very important guidelines. They are broad. They are consolidated guidelines. They are looking broadly along sexual reproductive health. And what the guidelines look at is in programming, what can be provided through self-care, either with support or without the support of healthcare providers. And self-injection is one of the interventions that is recommended in those guidelines. In terms of their use, I think the guidelines, one, is that they open the opportunity for countries really to expand these recommendations beyond just statements of what is safe and can be provided, to extend it to how it can be provided. And the guidelines do list out a lot of very important principles that must be adhered to as we think about self-care. One which comes to mind is that self-care should not be a mechanism by which the healthcare system shirks its responsibility to the clients. So it should not be a way by which hard to reach or marginalized populations are not provided with services and then are relegated to provide the services for themselves. So the guideline is important. For its implementation, of course, there's need for development of tools and other kind of protocols that will convert this into a practice that can be rolled out. And some of it has already been included in the latest version of the Global Handbook, which includes recommendations on how, for example, training can be done, how women can self-inject, and so on. So I think that is as far as self-injection. And there are many more other aspects of self-care beyond self-injection. Thank you, over to you, Nandita.
Great, thank you, James. Tembi or Lucy, does anyone else want to comment on the self-care guidelines and specifically on self-injection?
I will comment on self-injection. In South Sudan, IntraHealth is implementing a dedicated family planning provider model. And with the advent of COVID, those dedicated providers realized that quite a number of clients would be unwilling to come to the health facilities for service. There just wasn't information there. And they started on self-care, selecting carefully clients who could self-inject at home, including clients that they could follow up via text messages or a phone call, or who could contact the health facility for support in case of any problems, or contact their community health workers. And they did initiate self-injection of Cyanopress on quite a number of clients actually who volunteered to re-inject with the support of the community health workers. I think I liked what James said, is that self-care does not mean that service providers' responsibility for clients and quality of services are just completely surrendered to clients, but it's a very supportive care that is given to clients. And what they did is that they did train over a period the clients who had volunteered for self-care and self-injection to ensure that they could do it correctly, and that they looked at issues of storage for the Cyanopress and disposal of the Uniject after use. And then, of course, access to that support system that the service providers would call the clients to remind them that they are due to re-inject, and the clients were free to call the service providers in case they were having challenges or they were having problems. So that was an initial, I think, step that then the Ministry of Health, UNFPA, and other implementing partners in South Sudan decided to orient through their trainers and to orient everybody on self-care and use of cyanopress by clients, or self-injection of cyanopress by clients.
Great,
and that is
thank you.
going on. It's a little bit slow, but there are some clients who have successfully, who are successfully self-injecting.
Wonderful. Thank you, Tembi. That's a great insight from the field, and exciting to see how that work will move forward. We have a few more questions. One is around advocacy, and knowing that country contexts differ and advocacy needs and objectives vary. Maybe this is for Tembi. Can you reflect a little bit on how you used both the HIP briefs and the WHO guidelines in some of your advocacy work, and how effective they were? I think you mentioned that a little bit with the task sharing. 8 pages is long for an advocacy brief, and yet the content in the HIPs is quite valuable. So how did you find using those materials for advocacy in your work?
One of the things we did was to look at what does the local policy say about the various things. When were the policy guidelines, or the policies and guidelines at country level updated? And really understanding the points of view of the various stakeholders in understanding the barriers to policy changes, and hearing why they feel it will work and what will work in that context and what will not work in that context, and going back to the various pieces of evidence presented in the HIPs, evidence presented in the WHO guidelines, and try to contextualize that. I think one of the things that is not an easy process. It's not like, oh yes, we can change because WHO says yes, we can do that. I think we have also seen some countries say we need to be able to generate our own evidence to ensure that what we are adapting works. I think one of the things I always say, and that seems to work, is let's do an introductory. As long as we understand that we are doing no harm, let's do an introductory at country level and see what works and what doesn't work. I think there should also be willingness to adapt, because we are not saying adopt everything that is said in any context. I think there has to be some kind of adaptation. But even adoption sometimes works, because what might be a barrier could be some aspect of the health system that is a barrier to smooth implementation of a HIP, or that is a barrier to implementation of some of the WHO guidelines. So yes, I agree. It depends on the context. It depends on the health system and its capacity to be able to adapt the HIP and the guidelines. But I think having those tools and showing them the various contexts in which they worked. I think what I liked about both the HIPs and the guidelines, it does show, it does provide you that it worked in this country, and you can look at what was the condition and the health system in those various countries. Is it similar to where you want to do that adaptation? And then you have to definitely have your advocacy messages there. Adoption means people are saying, what's in it for us? What difference will it make to our program that we need to implement this? But remember, some of it is just that. Like in pre-service education, we found the curricula had not been updated for years. And over the years, there have been changes in technology, there have been changes in content. And that was fairly easy to advocate, to say, you know what, let's change this. This is old, and it has changed. So it really is contextual, and what you are trying to look at, and what are the barriers to adoption of the high impact practice, or the barriers to, and not just barriers, what are those factors that are facilitating that you can look at to build on?
Wonderful. Great. Thank you, Tembido. That was excellent. Thank you again to all of our presenters and to our participants on the line for your participation. We're a little bit ahead of schedule, but I think we will then have time for one more poll question. Now that you've heard about the guidelines, you've heard about the HIPs, you've seen this tool, we'd like to know from you, how do you plan to use this tool, this matrix, in your work? And just go ahead and give us your answer, and we hope to continue the discussion with all of you. Just a reminder that the tool is available in 4 languages, English, French, Spanish, and Portuguese. And we will be planning another series of webinars in those languages in the new year. So for those who are interested in a similar webinar in French, Spanish, or Portuguese, we do plan to host those in the coming months. Again, you can find all of the information on the websites, both at WHO, the High Impact Practices, or the IBP Network. And I think we will go to see the results. And great. So it looks like a lot of you plan to use this as a general reference, which is excellent. Also as an advocacy tool, some for programming, training, and some are not sure, which makes sense. This is the first time we're launching this tool publicly. So we look forward to hearing more from you about how you're using this in the field and how this can be used to improve your work. Thank you again to all of our presenters. You know, we really enjoy hosting these webinars on behalf of WHO and IBP. It's an opportunity for us to present WHO guidelines and different resources to our network of civil society and NGO partners, and we really appreciate your participation and discussion in these sessions. For more information, you can visit the ibpnetwork.org website, or WHO, or the High Impact Practices. And with that, I will just thank you again for your time this morning, this afternoon, or this evening. Thank you again to our presenters, and do stay tuned for the next webinar. Thank you, everyone. Goodbye.
Thank you. Bye-bye.